Good evening to all of you. Thank you for the kind introduction. I know all of you are tired, so I will make my presentation as short as possible. First of all, I would like to thank the President and the Organizing Committee of Nepal Radiology Association for inviting us to represent Sri Lanka College of Radiologists at this forum, and also allowing us to make some voice for our own country. Also, I sincerely appreciate the great Nepalese hospitality throughout our visit. Sri Lanka is a beautiful island which is located in the Indian Ocean, and it is also known as the Pearl of Indian Ocean. It's a compact, breathtaking island offering immense geographical diversity. In just a few hours, we can travel from pristine golden beaches to misty tree-covered islands. It features lush rainforests, 103 rivers, dramatic mountains, and ancient cultural heritage sites, blending intense diversity with incredible scenery. Today, I'm going to talk on diagnostic and interventional radiology services in Sri Lanka, where we shine and where we struggle. As an introduction, as I told you, Sri Lanka is an island in Indian Ocean with surface area of 65,610 square kilometers, with a 22 million population, 9 provinces, 25 districts, and unfortunately we are a nation who have faced many challenges in the past, including terrorism and civil war for more than 30 years, tsunami in 2004, COVID pandemic, economic crisis in 2022, and Ditwa cyclone in 2025. At the moment, we are experiencing a fragile economic recovery following severe economic crisis in 2022. If we talk about health system in Sri Lanka, we have totally free healthcare system in government sector. It has a well-established private sector hospitals in most of the major cities. We have 12 medical faculties, state medical faculties, and a postgraduate institute in Colombo for medicine, which offers PG postgraduate training courses for every internationally recognized specialties and subspecialties. We have 3 national hospitals, 12 teaching hospitals, 16 district general hospitals, 12 subspecialty units, and 35 base hospitals, many other divisional and rural hospitals. If I talk about radiology postgraduate training in Sri Lanka, we have 8 main training centers with several specialized training centers which provide subspecialty training. And at the moment, we have 232 trainees in the training program, and who usually enroll after a competitive entrance examination. We usually take 22 to 25 trainees as the annual intake. After enrollment, they undergo 3 years of pre-MD training and 2 years of post-MD training after the exit examination. Out of the 2 years post-MD training, 1 year is a compulsory overseas training in a recognized training center which is accredited by the Board of Study in Radiology. Also, we are offering subspecialty training in interventional radiology, pediatric radiology, neuroradiology, and others are still awaiting. This we have started in 2015. We have radiologists in all hospital categories except in divisional and rural hospitals. More than 90% of the current cadre positions are full. And we have about 300 life members in our college, and subspecialty services are available in interventional, pediatric, and neuro. And we are catering for all the specialties and subspecialties across the country. If we talk about the availability of equipment, we are a low resource country, I would say, though we have improved a lot during last 10 years. Plain X-ray and ultrasound are freely available in almost all the centers. And CT, if we could talk about CT, we have about 45 CT scanners installed throughout the country, covering almost all 25 districts. But less availability of MRI, obviously. We have 12 or 13 in the government sector, but several CT and MRI machines are available in the private sector as well. Further reduction of DSA and SPECT and PECT is seen because we have few DSA machines, about 8 or 9 in the country, and we have only 4 SPECT and PET CTs, but there are few in the government sector, private sector as well. With regard to mammography, we have 22 machines scattered throughout the country, giving services to all districts. Where we shine is another important thing to discuss. Though we have a low resource setting, we are giving the maximum care to our patients. At least we are trying our best. So we have a totally free healthcare system, which is a great asset to our population. And we have a very transparent entrance pathway, so PG training. We also have a well-structured training program, including research. The compulsory training exposure in overseas is a very good component of the training program, because that gives an opportunity for our trainees to go abroad, learn about the latest advances which are not available in the country, and come back and serve our country with international standards. Also, I would like to say that though we have started compulsory training overseas, it's a good asset actually, and transparent appointment system after board certification. That means usually after board certification, the Ministry of Health gives appointments according to a point scheme based on seniority and academic performance. So there is no personal influence, and it is totally independent of political influence as well. At the moment, we have adequate number of trainees and adequate number of radiologists to cover the current cadre, but it is not adequate at the moment, but we have fulfilled more than 90% at the moment. And subspecialty expansion is also we are happy about, though we have started in 2015. Though we have certain areas to shine, but we are struggling in many areas. Like at the moment, as we are having a fragile economic status of the country, that is the main drawback, I would say, with regard to healthcare system, not only radiology, but all the other specialties as well. Also, we are not very happy about the lack of progression of the expansion of the subspecialties. Though we started in 2015, we have not been able to give cardiothoracic, oncology imaging, MSK, women's imaging, and abdominal imaging, mainly due to it was due to the economic crisis, and it came to a standstill because of the financial issues, and that is a drawback actually at the moment. And we are a limited resource setting, as I told you. Cross-sectional imaging, especially MRI, SPECT, PET CT, and also DSA are limited availability throughout the country. Because of that, we have long waiting lists, and also we are deficient in PAC systems. We have 5 hospitals with established PAC systems, which was to expand for 22 hospitals, but the project stopped in 2022 due to economic crisis. Still, it is not happening. So we are limited for PAC system only for 5 major hospitals. Also, we are deficient in AI resistance. So actually we are starting for AI-assisted equipment at the moment. So we are thinking and we have to expand in AI assistant in radiology services in Sri Lanka. Also, we are lacking a well-established pre-screening program. It is mainly due to the limitation of availability of female radiographers. Not only female radiographers, even the radiographer services are quite deficient. Most of the hospitals, the cadre is filled only to 50 to 60%. So there is quite a restricted number of radiographers in most of the hospitals. And though we have fulfilled more than 90% of the current cadre is not at all adequate because of the demand for imaging studies in most of the hospitals. So we have to increase the existing cadres to meet the requirement of the hospitals. And other thing we are struggling is because of the economic crisis, most of the new generation radiologists as well as skilled radiologists started migration to developed countries for their own good. So that was a big impact when we talk about radiology services in Sri Lanka. Though we struggle in many aspects, there should be a way forward. So we have proposed following ideas to the responsible authorities. That is to establish private-public partnership for modern equipment to improve infrastructure, and advanced equipment with AI incorporation, reactivation of subsidiary training, which stopped in 2022. And also we are happy to tell that we are installing a cyclotron to produce our own nuclear medicine stuff for PET-CT. So we hope that the PET-CT services will expand in future in Sri Lanka. And also the government will have to find donors and international partnerships to develop infrastructure in government hospitals. And we have highlighted we have to expand the cadres to increase the efficiency and reduce the work burden for the radiologists. And we need to find better reporting systems and improve the communication between the hospitals. And we have to optimize the existing resources like mammography and continuation of after-hours work for routing cases to reduce the waiting list. And also cluster system to be proposed to mainly to the peripheral hospitals. So as Sri Lankan radiologists, we have a lot to do at present, also in future, to make our dreams come true. Thank you very much. We are having our annual academic sessions in 2026 on 18th, 19th, and 20th of September. I would like to give you an open invitation to participate and experience Sri Lanka, which is a beautiful country, and I invite you to experience the Sri Lankan culture and the hospitality.